I've come to a demonstration of the efficacy of an extract from tomatoes. Everyone's concerned about risks for heart disease, the biggest killer globally and in the UK. So everyone's aware of the risks of high cholesterol, everyone's aware of the risk of high blood pressure, lack of exercise, diabetes, stress, all these factors. But actually diet's so important. And rather than take tablets, I would much rather direct people to healthy nutrition and useful supplements. We've heard about a simple extract from tomatoes as effective for the blood flow in the human body as aspirin. And that's really so almost a pharmacological effect of something as simple as a tomato extract with no side effects. So when you consider the side effects of aspirin in terms of gastric erosion, ulcers, and other side effects, you know, this has got to be welcome. So it's simple, it's something that people can take without thinking that they're having pharmaceutical medication, free of side effects, with proven scientific efficacy. So I think that's a really good step forward and something that I've been very interested in.
Ripflo is a dietary antiplatelet. It's a novel kind of food ingredient which has been developed to help maintain a healthy lifestyle. It's derived from tomatoes, it's completely natural, but it's lycopene-free. It's not associated with the red colour of tomatoes in the way that many tomato products are. And it's been shown to help maintain normal platelet aggregation without side effects. It's suitable for healthy adults who want to keep living their healthy life. The clinical studies that we undertook have taken over 10 years to conduct. We've done a whole range of clinical work. We've really established that Fruitflow has an effect similar to aspirin, but in a milder and more reversible way. And we found that when taken daily, it doesn't have the same kind of side effects as aspirin has.
I think the science is definitely convincing because we looked at mechanistic actions. There are lots of things that we say, you know, to our patients that have no evidence. For example, apples are good for you. Where's the evidence for that? Well, you know, there are lots of constituents of apples that are good for you, but actually there's very few studies on it. And I think we can get too hung up on what's good and what's not good in the longer term. So, you know, there's no doubt that this is of benefit, and I think anyone that disputes it really needs to look much more closely at the mechanistic evidence of what happens to blood vessels, because there's no doubt that this decreases the likelihood of you forming a clot in your blood vessels, and that is what causes a stroke or a heart attack.
So I get people who come in and they ask me, should I be taking an aspirin, doctor? And we can't actually say, you know, you as an individual, no, probably you don't necessarily need aspirin, because we've got to weigh up the benefits against the risks. And let's be honest, there are some significant risks with taking aspirin every day. And so for those people, I would say, do you know what, why don't you just try this instead?
If you wait until something major happens, then it's maybe too late. I think there are things that you can do in advance that can reduce your risk of heart disease. Obviously, maintaining a healthy diet and lifestyle is key. But when you have a product which is evidence-based, which has a positive EFSA European health claim that it can improve cardiac risk factors like blood flow and reduce platelet aggregation, I think it's a useful alternative to aspirin for people that don't want to take aspirin. Obviously, aspirin does have known side effects, not everybody can take it, and this is an alternative which is useful for many people.